Hello everyone, welcome back to Drugs Decode. Today, we're diving into an essential class of antibiotics, aminoglycosides. These are powerful bactericidal agents primarily used to treat severe gram-negative bacterial infections. Let's explore their mechanisms, pharmacokinetics, uses, and adverse effects. Aminoglycosides are protein synthesis inhibitors that are highly effective against aerobic gram-negative bacteria. Common examples include gentamicin, amikacin, streptomycin, and neomycin. Unlike most protein synthesis inhibitors, aminoglycosides are bactericidal, meaning they kill bacteria rather than just inhibiting growth. So, how do aminoglycosides work? Their action involves three main steps. Entry into the bacterial cell. Aminoglycosides enter through porin channels in the outer membrane of gram-negative bacteria. They require oxygen and energy for transport into the bacterial cytoplasm, which is why they're ineffective against anaerobic bacteria. Binding to the 30S ribosomal subunit. This disrupts protein synthesis by inhibiting the ribosome mRNA complex, causes misreading of mRNA, leading to defective proteins. Blocking translocation prevents the ribosome from moving along the mRNA. Next, let's look at the pharmacokinetics. Aminoglycosides are poorly absorbed orally due to their high polarity. So they are usually administered intravenously. However, neomycin is used orally for GI infections as it stays within the gut. They distribute well in extracellular fluid, but poorly penetrate the CNS, adipose tissue, and bone. They accumulate in specific tissues like the renal cortex, inner ear, and fetus, which contributes to their toxicity. Aminoglycosides are not metabolized and are excreted unchanged by the kidneys. This means dose adjustments are necessary in patients with impaired renal function to avoid toxicity. Aminoglycosides are used for several clinical applications. Severe gram-negative infections, septicemia, complicated UTIs, and hospital-acquired pneumonia. Tuberculosis, streptomycin is a second-line agent for multi-drug-resistant TB. Combination therapy. For gram-positive infections like endocarditis, aminoglycosides are combined with beta-lactams or vancomycin. In bowel sterilization, neomycin is used before colorectal surgery. Respiratory infections in cystic fibrosis. Tobramycin eye drops for bacterial conjunctivitis. Neomycin for minor skin infections. While effective, aminoglycosides can cause significant adverse effects. Nephrotoxicity, accumulation in the renal cortex, can lead to kidney damage, which is usually reversible. Ototoxicity, damage to the inner ear, can cause hearing loss or balance issues, often irreversible. Neuromuscular blockade, rarely, they can interfere with neuromuscular transmission, leading to respiratory paralysis. Allergic reactions, hypersensitivity is rare but can occur. To minimize these risks, therapeutic drug monitoring is crucial, especially in patients with renal impairment or those receiving prolonged therapy. To summarize, aminoglycosides are potent antibiotics with a unique mechanism of action and a specific role in treating serious infections. However, their toxicity profile demands careful monitoring.
Thank you for watching. If you found this video helpful, please like, share, and subscribe for more content about health and medicine.